So welcome to general meeting for April for the Qhsc. Today is April 13th, 2024. Right now is 9:05. So thank you for everybody who came in early. Dr. Dorothy, I know she was in and out, so that was great to hear from her. And then so we do have Dr. Paranka Siakabe, Ms. Bree Vargas, Mr. Oliver Brown, and Mr. Steve Jones. So thank you for coming, Erin. I know. So the meeting today is focusing on the medical mission. So everything about the medical mission, at least to give the new people who we are trying to recruit an idea of how the medical mission is, the expectation and plan of the days, things that we need to do during that time. And then so it's going to be a lot of information like that. The medical mission is from September 13 to 28. So even the potential tickets now, we have been working with the agency are running around those 13 to 28. So people who are living in a different state, you might have a different date just because it depends on where you are living from. Some people have to connect within the country and then meet all of us in Dubai. So that's why you might see, I keep saying tentative 13, 28. Definitely that some of us will be leaving on the 13th. Some of you guys will be leaving on the 14th. Still, we meet in one place and then go to Tanzania on the 14th. And then coming back, majority of us will be coming back on the 28th. There's some people who may come back later, depends on their flights. But we make the arrangement. We're not going to leave you behind. We're not going to let you fend for yourself. But so everybody else is gonna come in the same, we're leaving the same time and they're coming back around the same time. So again, the medical mission is on between September 13th to 28th. And then that's comprised of 2 weeks, minus a day or two when traveling, going there and come back. So this will be the 5th medical mission going as a group, but we've done medical mission without as an individual before we started as a group. Meeting today is plans for the 2024 medical mission, the timeline of activity, what are we going to be doing, the payment, how much is going to be for individual payments, and then also as the local transaction. So that means when you get to Tanzania, how much it's going to cost us. And then we're going to review a little bit of the tips of how we prepare from now, things that we need to do right now or as we're getting ready. And then majority of that topic is going to be on August meeting, because that's the day that I give you the schedules, what you need to do, what things you need to pack to make sure you have all those necessities when you go to Tanzania, then you're covered. And then we're going to go over the accommodation, transportation, or give you the range of things that will be covered through that one. And then we're going to have the fundraising event. So that's why usually once you know the project and you decide, okay, I would like to work on this project versus this one. And then so we ask you to try to work on that project and try to raise money and buy get supplies as much as we can. And then we ship them, or some of them we're probably going to take with us to Tanzania as a second bag. Okay, so project-wise, so community programs, including the nutrition and hydration. So this is a project that we encourage, we raise money here, and then when we go to Tanzania, we go and buy lunch for these children. So we're going to one of the schools called Minazini. It's in Dar es Salaam. It's a limited resource area. So most of the kids don't have lunch during the school day, and majority of the kids cannot afford to buy lunch. So while we are there for those 2 weeks, we buy them lunch. So when we're getting our lunches, and then of course we want them also to eat. And on top of that, we usually do the nutrition program with the kids, because we want to make sure the kids are getting the food, and then they need to know what nutrition food they're eating. So what kind of food they eat, is it good for their eyes, good for their ears, at least to support their education needs. Dar es Salaam is hot, so people live like in Florida, Texas, that kind of heat, but it's not humidity because it's an equator. But once you get there, of course, under the tree, you have a shade, then that's better, but usually it's the direct sunlight. So the kids are always dehydrated. So we have that program, we buy water bottles, and then we go and donate for those kids. So at least the kids, we have something to help with the hydration. So we make sure every single child has that, and then we encourage them to bring to school every single day. They do have a water source at school, but the water source is like in the middle of the school. So the kids have to still fetch the water and then take it to the classes, especially if they're going to do sports. We want to make sure the kids have water in front of them so then they're not dehydrated. So it has been successful. We've been doing that for almost 3 years now, and the children love those water bottles. The next project is, before I forget, just for your awareness, if you are going to school and you want to work on that project, for the kid, just think of this. If you have $1.50, you will be able to buy 5 lunches for a child for a week. So that is how much it costs for them. And then we usually buy for 830 kids. So we including the teachers also there, because they also usually use their funds to support these children. So that's just like you have that amount in your head. So when we are asking for donation to be able to buy that lunch for them, we appreciate that. Just think, okay, even if you don't have the money, you have $10, that would be great, because at least we can buy almost 4 or 5 kids lunch for the whole week. And then so at least those children will be able to eat, have their full belly, and be able to pay attention to the class. And hopefully in the future, they will break that cycle of poverty, because remember, these are the kids that are coming from very low resource area. So the cycle is always for poverty level. So if we can feed them and have them concentrate in school, then they'll be able to be successful and break that cycle and go back to help their own community. So that is almost a long-term goal. But our immediate needs is just to at least give them money so buy them lunch, and then so they'll be able to stay in school. The second project is sports. So for sports, these are for still non-healthcare people that we go and train with these kids. Remember, for the kids, only just studying by itself and eating healthy is not going to satisfy all their developmental groups. So we have to also help them with staying healthy, doing exercise, the PE. So people who have experience with the exercise here, coaches and stuff, we want them to come with us and be able to design certain projects. Then they'll be able to help these kids and keep them healthy. And then also we usually work with one of the youth group is called Magnet Youth Soccer Club. And that part also is an elite, almost like a travel team here in the United States, like you comparison like that. So these are the kids that they are able to join this group, but still they need their education. So prevention of minor injuries, their nutrition. So they should not be eating pizza when you're going to do exercise. We all know what pizza is going to do on your stomach if you're going to run around. Of course, hydration also for them is a big deal. So also we usually give them the water bottles to help them, because they do exercise 2-3 hours a day in the heat. So keeping them hydrated is a big thing. And then teaching them first aid. So these kids are staying in the sun for a long time. Sometimes they end up passing out. So we have been doing like those health education for them and do CPR with them to help them. If somebody faint or somebody stop breathing or somebody their heart stops, so what do you need to do while you are waiting for help? So we were able to do that last year, and we want to continue this year. So if you're interested in those non-healthcare projects, please let me know. Vision and hearing screening. So we do have the medical people who still go to the hospital, and then we come back to the school and then go with that. We arrange to make sure we screen the kids for hearing and vision, and then also usually we screen the parents. So the parents, from the previous experience, the parents have been showing a lot of deficit there, especially for vision, because a lot of parents do not have routine care. Here, United States, if you have vision issues, maybe the annual visit with the doctor, that we figure it out, and then you need to go and see the vision doctors. But in Tanzania, they don't have those routine care to capture that. So we do that from school and screen that, but and end up figuring out, like last year, it was almost 47% of the parents needed glasses. And this is not necessarily that they have the disease in their eyes. No, it's just reading glasses, just a simple reading glasses. And that's why we were able to raise quite a bit. I think last year, almost close to 1,000 pairs of glasses. And we still have issues, challenges to distribute them, but that's one of the areas that we can help the parents. Because remember, if the kids are coming from school needing help, and then at least the parents needs to be able to see their projects and stuff. And then of course, also for them, if they're able to see, they'll be able to read at work, and then hopefully getting a better job and be able to support from their family. So we're trying to address from the kids' standpoint and from the parents' standpoint. And also for the parents, you include the nutrition part. If the parents know what the children needs to eat, they'll be able to buy that. But even if they have limited resource, the wherever they can afford, they buy something that is going to be beneficial for their kids for vision and hearing. And that's why we are trying to address those parts. So people who wants to be in school and help with that part, please join us. Hand washing and dental hygiene. So for these kids, definitely we want them to know about hand washing. Going to the bathroom, and then coming out of the bathroom, even if there's a limited resource of water, but at least they do have water somewhere. So then they should be able to wash their hand before eating. They should be able to wash their hands. We want them to know that because that's what's going to be preventing the disease. And of course, we had COVID to thank for. People, a lot of people are aware of it, but still we need to reiterate and reinforce for these children that they need to wash their hand as soon as they can. Dental hygiene, brushing their teeth. This is the age that the group that sometimes they have candies here and there, they're eating, the diet is also loaded with high, carbohydrates. And we know eating all those stuff and then you don't brush your teeth, it's gonna cause issues with your teeth. So definitely for the kids, they need to know how long they should brush their teeth and all the stuff. So we always encourage them to do brushing their teeth twice a day. And then usually we raise money to buy the toothpaste, and go and give to every kid, at least when we are demonstrating for them, then we are able to show them, okay, take this toothbrush home and toothpaste, and then you should be able to brush the teeth. So then they go and practice at least what we are teaching them. The sanitary pad was a new project last year, and we really want to continue with that part. So this is almost what we call stay in school project for the girls, especially from the 5th, 6th, and 7th grade girls. The problem is happening right now. They don't have the money. They don't have resources to buy sanitary pads. It means like to take care of themselves every month, especially if they have their menses. So they stay home for 5 days. So every month they miss the class for 5 days. So if we expect them to be successful in school, how are they going to do that if they're missing almost half of the, almost 2 or 3 months, a whole year in school, and they're going to be left behind, and then they're not going to be successful. So we are trying, as I said, to break that cycle, to try and help them reach their goal of getting an education, and hopefully advance their goals, and then come and help them, their family. So we always raise the funds here and buy the sanitary pads, the disposable ones, and then you go. Last year, we were able to give them at least for 2 months. So this year, we want to stay continue getting as much as we can. And then whatever we have, we're going to be doing. Our long-term goal for this project is to be able to buy those reusable underwear. So then at least if we give each girls 2 or 3 of them, so at least they can wear in the morning, wash it, and wear at night to wash it in the next morning. At least that one also, of course, is good for environment, and also it's going to be lasting a little bit longer, at least ensure for the whole year versus us giving them for 2 months. However, whatever we are getting now from the donation, that's what we're going to do. We're going to buy those sanitary pads, disposable, or people donate those sanitary disposable, and that's what we're going to be giving them away for these girls. So we are getting excited because I have a few people who have already started working on this project, but if you're interested in joining in and this touches you and you want to share it with your groups, sororities for the ladies, please let me know, and then we can make those arrangements so you help these kids. Okay, hospital side, help baby breathe. So if you are able to go to this hospital.
We can't hear you.
Yes, you're muted.
Hi, can you hear me now?
Yes, and we can see your screen.
Okay, good. I doesn't understand why was it muted. I just saw you were muted when I started talking. Okay, so this is 19. Okay, so for the hospital part, Help Baby Breathe is one of the projects very dear to us. That means for people who are healthcare workers and aware of women's health, this is almost similar to the neonatal resuscitation for the baby. So they don't have all this fancy stuff to help and practice the neonatal resuscitation, the intubation, the warmers and all stuff. They don't have that part. So what they do for the World Health Organization and UNICEF also work on that area. It's called Help Baby Breathe. Their goal is to transitioning the baby after the baby is born and how they behave outside their mom's uterus. And then, so what are the things that they need to do? So those basic things, the stimulation, drying and stuff, those are the things that we need to be able to do. Yes, we always buy some supplies, you know, like we get all those, the intubation sets, we have the non-breathers mask, we have the tubes, So we will do those things in the hospital until the supplies run out. But most of the time, we want to make sure we teach them just things that they need to identify if the baby's cold, this is what you do, and which is connected to the thermoregulation part. So once the baby's okay, the baby's breathing is crying, okay, what are we going to do with that baby? Keep that baby nice and warm. Yes, the SM is warm, but remember, there's draft, there's no glass on the windows. So there's draft, the air, the wind and stuff, all those things are going to make the baby cold. And then of course, some of the mom don't have resources to buy those little blankets, little hats, little hoodies and all those things they don't have. So we always raise money to buy those, the onesies, the little booties, the diapers, and the blankets. And then we always, while we're teaching them how to take care of these moms, so each baby gets a little bundle of little hat, onesie, little mittens, booties, diapers. So that mom will get. So we try to get to all the moms who deliver at the time that we are there, get those the babies get those bundles. So we always need to buy as much as we can. We've been fortunate previously, we've collected a lot of little hats and people crochet those hats. Thank you very much, because one time I think 2 years ago we went with 5,000 of those little baby hats. So it was a very, very successful project. So definitely we still need to do the same thing this year. If you're interested in those areas or you are qualified in those areas, means baby. So definitely help us with that, so then you can focus on raising money, get those blankets and stuff. So we'll be able to, when you're teaching the thermoregulation for these babies, then we can be able to protect these babies. Postpartum hemorrhage. So prevention of postpartum hemorrhage is a big deal. So according to the World Health Organization, statistic-wise, almost 47% of all moms who delivers and experiencing severe postpartum hemorrhage lose their life. To me, those are preventable deaths. So that's the area that we really push it to try and make sure that people with experience with labor and delivery, even if we have 2 or 3 people who experience like that, and then other nurses or doctors wants to work with that project, please, let's go and help these moms. Simple things, do fundal massage, help them making sure their vital signs are okay, monitor them, educate them. If you get this, identify this, report this. So all those things we need to be able to catch up and try to go and teach these parents. And then also for the postpartum hemorrhage training, we do quantification of the blood loss. So also we buy scales, we buy the pads. Anytime that the mom delivers, we try to show them that estimating blood loss always is going to underestimate, and then it's going to cause delay of care. So if we measure and then we know for sure that this mom passed 1,000 blood loss at the delivery, we know they're already in postpartum hemorrhage risk, and they are going to be in postpartum hemorrhage procedures and interventions. We have to start early. We don't want to wait until the person pass out because they're losing too much blood. And the problem is, the challenge we have is when the moms delivers, they don't stay that long. We don't have 48 hours to hang out with this mom and observe them. We don't. Most of the time, they might go home within 24 hours. So we need to have that training to say you have to identify them early, know the risk factors, and then identify as soon as they deliver. So we need more people in that area to be able to monitor those things. And because sometimes they have 4 or 5 deliveries within an hour. So you have to do fast those things. We need more than 2, 3 people in that project. So if you're interested in your labor and delivery nurse, please, or even postpartum nurse, please join us in those areas. Or even if any nurse who wants to work in that area, please let us know. ICU, so people who are really acute care nurses, we need your help, because there's a lot of stuff going on. Yes, we don't have all those bells and whistles here you have in the United States. I want you to take your skills, come with us, and then work in the area that there's no those resources. Use your brain to try, use your critical thinking to try and help them. What are the things that they need to be able to figure it out if somebody is deteriorating? What do you need to do? Instead of calling the rapid response, what do we need to identify and teach them so they can identify those people who are sliding down, save them and bring them back? So Dr. Gwen, always an excellent resource there. She always teaches the nurses and the doctors, and we need now ICU nurses also to come and help us in that area. So if you're interested in that area, please, compression and ventilation. So this is a big deal. We know every area in the community, in the hospital is needed. So CPR, it is the big deal. They don't have the expectation that we have in the US, like if somebody's stop breathing or somebody's heart stop, I call 911. They don't have that. So we have to be there teaching them what are the warning signs. You know, the muse, what are the warning signs that the patient is showing they're going to end up having cardiac arrest or respiratory arrest? We need to be able to know that. And then once they identify that person who is in trouble, what they need to do? Compression. So how do they do the compression? Effective compression, effective frequency between the compression and ventilation. How do you do it? How do you assess that you're doing effectively? How long should you do that part? And then what are the things that you need to do? You know, those are H&Ts. The healthcare worker will know what I'm talking about. So we need to be able to tell them, okay, if you do at a certain time, at this long time, 5-6 minutes, you're not doing, you need to start thinking of A, B, C, D. So people who are passionate, working the CPR, saving lives, identify screening, okay, come in and work with Bree. Bree is, that's her baby. She's working so hard to try and get that program going. So if you really wants to do that, but she needs a lot of people because we want to plan to teach all the nurses, all the doctors in those 2 hospitals that we're going to be working on. So it's going to be almost like every single time we show up in the hospital, this is going to be the project going on, even if we are in the unit. So you're interested in to do this pumping of the chest, we are going to have the mannequin, which is going to be helping us to make sure we do the effective skills. So come and join us. The last one is school collaboration. So this is almost, we're trying to inspire the children from Minazini to see beyond their country, beyond their city, beyond their continent, and see, okay, have a window of American kids who are in Texas. So what can they share? What are the common things that they have? Can they learn from each other? What are the things that the American child is doing compared to Tanzanian kids? And also we want to inspire the American children saying, what are the Tanzanian kids it's doing that I could do also? So we're trying to give them options. We're trying to inspire them beyond their problems of every day. And then so that if they think like that, they'll be able to say, okay, let me study hard because I'm going to be this title because that's what they want to do. Oh, I want to go to America. If we can inspire them someday to come to America because of this project, we want to be able to do that. So people who are working their school and you're interested in working that program, yes, Dr. Siakabe and Mrs. Victoria Jones are working on that project. You can go and help them with that part. So once you make that decision with this project, we'll be able to link you in with the leaders on those areas. So for example, for nutrition, we can work with Mrs. Christine Behuniak and Ms. Teresa Cooper. So then they can give you things that they're doing to try and raise funds for that project to be able to say, okay, you can do on your state, wherever you are, to try and do the same thing and raise money for those kids. For the sports and magnet, that's Dr. Siakabe. Definitely, once you commit and you want to be that, we direct you to that person so you'll be able to connect. Vision screening, hearing screening at school, the logistics stuff. Mr. Steve Jones works in that area. And then he's gonna help you to give you a window of what the typical day is, how long it's gonna be, what are the things that you need to do. So we're not going to throw you in the project that nobody's there to lead you. Those people are already in there to work with that part. Hand washing and dental hygiene, that's almost like a combined thing. You're gonna get the team that is in school to work on that part. Sanitary pad was our global volunteer, Tamasha Ngaropa from Tanzania. And then you have people who are volunteering from United States here. It's a combined effort. So once we know that, you're going to be put in there. For the Help Baby Breathe and thermoregulation, if you're thinking of what things you need to do or how the typical day could be, Dr. Msambi Chaka and Dr. Fabian Guido and Dr. Dorothy Wavrek also will be on that project. So if you need like just to know before you get there, what are the things that the typical day they can do, they can give you more details on that project. Postpartum hemorrhage, yeah, last year was Ms. Bree Vargas was able to do that, but even this year she can cover that part area until we get somebody else to do that. But that area also has so many people. Christy De Paris was here last year on that area. Also, she can support the people who wants to do in that area. ICU, I already said Dr. Gwen Randall, definitely we'll give you the information, then you can work with her, especially for people from ICU, then you can tag team and you guys work your magic over there. Compression, again, back to Mrs. Brie Vargas, she's gonna help that. But so as I said, you don't need to remember all this name. I'm just saying that so you know that each project is covered. We are not going to send you in the project by yourself. No, you are going to always have maybe 2 or 3 people have been there on the medical mission, so they're going to be helping you. So even if this is your first one, they will guide you through all the process. And so you're not going to be by yourself. So don't get scared. And if there's any issues, please let me know. And then we can make sure that you're aware of what you're signing up to. Okay, so those are the projects. I'm going to give you a time at the end so we can discuss, or I'm just going to go through all the activities. Okay, so timeline. So how we're going to do that if you decide to go to the medical mission. But first of all, thank you everybody for coming. I know I've seen like 13 people in there. So thank you for even making the time to come. So one thing that you are still probably unsure, go and sign in under the website, Dr. Gabone Qhsc, and then under 24 medical mission. If you click on it, then you should be able to see the form, the lead form, which is, you give your name, the phone number, they have a couple of questions they're asking. So then I know where I should be putting in place. And then I'm going to either get you on the phone call or one of the executive member, Valentine's or Dr. Siakabe, to be able to talk to you and then get more information. And then we direct you where you need to be. And if you have any questions, again, we'd be happy to answer. And then, of course, this is a QR code. If you want to be able to stop the video once we record it, you can scan that part. Even right now, you should be able to scan that part, and then it's going to take you. The question is probably like 4 or 5 of them. It's not that many. Just sign up there, and then we'll be able to get your information, and then immediately we'll be able to respond back to you. We have already had a couple of people last week already signing through that way. So it's user-friendly. Once you get, it's only one page, you just fill out that form. And sometimes if you open your phone, it's going to be probably you have to scroll down. If you have in your computer, it's going to be right there on the screen. And then give you the date, how many days, counting down. We're counting down because we're getting there very quickly. So we welcome you. As I said, the first thing is please go to the website and register so we know your interest, and then we can ask you and get you going. Okay. So as we are getting over there, because we want to make sure we protect the people that we are going to serve. So either in school, whether in the hospitals, or in the community, because we all know that we are all going to be visitors to them because we are going to their home. So we have to have specific information that is going to protect them and protect ourselves. And people who know that if you work with children, you have to make sure everybody else is with a clear background because you're going to start talking to these children. We want to make sure we tell them we are confident enough that whatever the team that is coming is safe, and we're going to protect the information. We're going to say, most of the time, sometimes we do pictures for during the medical mission. So when you do those pictures, I always write the letter to them even before we get to the medical mission. Right now, they have the letter saying that we are going there, we are going to do everything to help. If we're in the hospital, we're going to do everything in the hospital. All the information is covered by the people in the hospital. We are coming there to do like as a consultation. We're not going to like pick up a shift and start working as a healthcare provider. No, we're not. We are going to go there as a consultant, help them screening, help doing the assessment, help this, teach them those stuff. So we are still working with them at their routine care. The same thing, we go to school. The teachers are going to continue teaching their own stuff. We are going to have those moments if we need to teach something or train the kids, but the teachers are still there. And then, so when you take pictures, all those pictures are always geared to go either asking for more funds or showing that what we are doing for them so we can get support. And then, so we're not going to do this and sell that information. So that's why all these 4 forms from one or another is going to be addressing that part. So for confidentiality, you should know this is just like whatever you see, as long as you don't disclose the name of the person, the picture they're facing without clarifying like why are you using that the face of that person you're talking to, whether it's a hospital, in school, in the community. And then you cannot disclose. If they tell you something that is private, you cannot disclose that to everywhere else. So that's why those forms are there. And I'm going at the end, I'm going to let oh, maybe I can do it right now. Dr. Siakabe, are you ready? I'm going to click one form at a time, and then you give them like 2 minutes of each explanation.
Yes.
Okay, I'm going to start with the confidentiality form. So again, once you guys commit, you are going to get these forms, and then you're going to be able to have time to read. And then this is just to give you an overview of what is included on the form.
So there's 4 forms that everyone will have to look over, sign, and then return to myself or Dr. Harriet Gaboni. And the first one is the confidentiality form. And as mentioned before, it's basically to protect information, any information that we acquire while on the medical mission, be it medical information or personal information. And same thing that we would have to do while we're here. It's the same thing when we're there. So if we're, if we overhear or we are privy to medical information about someone, or even academic information about someone, let's say there's a child and we find out that that child has a vision impairment or a hearing infection or ear infection or something like that. Although, we're on the medical mission and this might be something we might discuss amongst ourselves, it doesn't mean that it's something that we would share with other people. And an example would be, we were on a mission one year. We were able to help a child. We've never seen that child again. We know the child's name, but we won't divulge to anyone exactly what happened and what that child experienced or anything like that. So we're still trying to maintain the confidentiality to protect the interests of the students and the patients and medical staff and anybody. So, all right, next form. This is I'm assuming this is the hold harmless.
Yes, it is.
Okay, so and this one is this is just saying that you will hold Dr. Gaboni Quality Healthcare and Consulting, or Qhsc. You'll hold us harmless. That we are doing everything that we can to guarantee your safety and do the best that we can to guarantee that whatever we've promised you in terms of your trip and the mission and everything like that, that we are going to do as best as we can to make sure that everything runs the way that it is. So in terms of trivial matters and things like that, you won't turn around and then try to, sue us for something or anything like that. Or if you have a medical condition, and you know that medical condition can present a problem for you when you're going on this trip, then you'll hold us harmless in terms of that. So you don't go there and then all of a sudden that medical condition flares up and then you try to blame us for it. So that's the hold harmless, which we will need to get everyone to sign and then return back to us. And so this video is also being recorded, so we know that you're also being asked to sign that form.
Okay, and the third one is the safety.
Yes, and that's the usalama kwanza. So safety first. So as I said before, we try to guarantee your safety. Definitely, if you follow your leader, which is Dr. Gaboni, we're not going to have you go places where it's dangerous. If you're in a workplace environment, we generally will ask them prior to the mission if there are any safety concerns that we need to know about. And when we talk about safety, we're not necessarily talking about security. We're just talking about it could be an outbreak of something, or it could be construction or something like that, or whatever. Any kind of safety concern, we'll ask them. And if they don't have anything, then we won't have anything to report back to you. But if there is something that comes up, then we'll come back and we'll let you know, hey, stay off the third floor, or don't go into this building, or whatever the case is. There's construction, or there's going to be problems with toxic inhalation or something like that, whatever. But we'll let you know. So that's the safety acknowledgement form. So we'll try to brief you and motivate you to stay safe and conduct yourself in a safe manner. And you just have to sign the form to let us know that you will obey all safety instructions. All right, we're ready for the next form.
Okay, to add it to it is like two things. On top of what Dr. Siakabe just said, the safety also is we travel in groups. And that's why I said, when you are going there to Tanzania, we want to travel in group as much as we can. I know sometimes it might be the airline, the flight that you are getting, it might not be there or delayed. I understand those things. Those situations we're going to address as an individual basis. But however, we are trying to get all of us together meet on one place and then come into the country. So when you come in as a group, then I will be able to figure it out, to talk to the people over there. So you don't have to be stressed out and start looking for, because the language you don't know, and then it's gonna make you stressed out. So we travel in the group. Inside the country, definitely, we are going with the bus or the shuttle. I know where you need to go. I know who you should be contacted with, because I know those people have already ensure me that there's a safety. And I always say a simple sentence that I would never send you anywhere that I don't feel comfortable going, because I mean, I'm from there. So, but still, there's the same places I cannot go because I know it's not safe for you. Because if you go there, you're gonna be seen easily, you're gonna be identified easy. And then on top of that, when you open your mouth to start speaking, they're gonna know you're not from there. So you become a target. So I don't want you to be in the situation that you cannot explain yourself. And that's why if we need to do, like when there are some days that we need to do some shopping, or some people are going to around the town, I will have people who knows us or part of the Qhsc go with you, so at least you'll be safe wherever you're going, because I want to make sure you're safe. I want to take you from here safely, and I want to bring you back safely. So that's my ultimate goal. The second example is when we had COVID. So they will tell us maybe, yes, we have these parameters to protect ourselves, but we don't have resources. So that year, I think that was 2 years ago, maybe 3 now, we went with our own gears. We had all the mask and so facial mask, we had the gloves, we have the gown, we have, if we were going to take care of them, we were covered, we were protected. Our PPE was out there. But we are not going to go there just to say, because they don't have resources, we're just going to go and subject that. No, your health and safety is important to the organization. So I want to make sure, so if I say, please don't go there, I'm not being mean to make sure that you don't go and explore. No, it's because I worry about your safety. People are going to get the visa for the whole year, because those are multi-entry visa. You get it as an volunteer. So if you are so excited about this medical mission and you go there and you enjoy and you want to go back and meet other people in Tanzania, please, you have the chance to go back, which is fine. But this time, let's focus on the medical mission so you can be safe and come back. And then some people have done that. They go with the medical mission, and then when they come back, they take their family and go with them. So that is great. But during the medical mission, let's just focus on what it's taking us to go there and then do what we need to do and then come back safely. Sorry, honey. Let me go to the
I was going to say, just to add to that, overall, Tanzania, and I say this all the time, is a relatively safe country. That means for me, it's a pretty safe place. You're not going to see, I'm from New York City originally, you're not going to see a lot of the stuff that you may see occasionally in New York. You don't see it at all there. You don't see it at all. So what does that mean? If you're in the wrong place at the wrong time, then that's a different story. But for the most part, it's a very, very safe place with wonderful and peaceful people. So as long as you are not out late and you're not in the wrong part of town or something like that, or whatever the case, you'll be fine. So we haven't really had a problem with anyone. We talk about we're focused now on quality. So we don't want quantity. We're not looking to take 100 people over there and go sightseeing and stuff like that. We need quality people to come and get involved within the school and the hospital community and in whatever part of the communities that we're looking to get involved in. So that's all we're really looking for. But
okay.
So we do encourage you, if you've traveled before and you've been on a mission, or you've been to Africa, or you've been to another country, we ask that you just follow our lead, because even I've been to Africa before, and my first time going, I just told Dr. Gaboni, I'm not going to worry about what I think I know or whatever the case is. You just tell me what we're doing, where we're going, and I'll follow your lead. And that's all you really need to do. And you'll learn a lot. So, all right,
Okay.
we're ready for the next one. Yeah.
So the last form.
Here it comes. Okay, so this next one here, this is a new form this year, and it's called a depiction release form. And this is basically myself. I'm the filmmaker, and I am going to be gathering digital content, videos, pictures, recordings, anything I can on my beautiful wife, Dr. Harriet Gaboni, because I am going to be working on a documentary on her and her life. And that includes us, that includes her early years, her formative years, and also QHSC and other things. So we'll be taking pictures and videos. So this is just a release form for whoever may be in these pictures and videos. We'll also be gathering digital content. We have someone who may not be going with us, Janet Namara Gaboni. So she may be pulling digital content from the WhatsApp group or whatever stuff we wind up sharing and stuff like that. And also if Bree takes pictures and videos and things like that, then those two will be considered as part of my team, and then I'll be considered as the filmmaker for the documentary. So that's what this is for. And if someone feels like, oh, I don't want to be in the documentary or something or whatever, then that's fine. You can just indicate that, or, you know, don't sign or whatever the case is. And then when we get ready to do the documentary, we'll confer with those people who are going to be in it anyway. So, but yeah, that's the depiction release form. So we're going to expect to get that signed. That's kind of similar to the other release form that you're going to sign, but that one's more for QHSC. This one is for the documentary itself.
Okay. And as we said, you guys are gonna get the time to read. That's why I was just giving you the overview, but you're gonna get the time to read those documents. And if you have any questions, please let us know. And as I said, we'll connect you with Dr. Siakabe to give you the background and why we do that. So we all do that just to make sure we protect you, we protect the people that we go to serve, because remember I said, we are the visitors to them. We are going to enter their own life. They have to share what they have with us. So they have to protect whatever they're sharing with us to make sure that, okay, we are okay with them. And that's why we're doing these forms, to say, yes, we are okay and we're not going to abuse this information, because everybody knows that you don't want to be, at a vulnerable time, you don't want people to come and publicize everywhere else to show you that you are, at that disadvantage time. But anyway, so after that, as a global volunteer, we're definitely one of the meetings that we always encourage and strongly encourage for you to come is the August meeting, because that's the time that we want to make sure we check off, we have our checklist. You have your passport, you have your visa, you have the travel insurance, you have your, not immunization, you have your clearance from your physician for what you need. You have your anti-malaria, because usually after that meeting, usually beginning of the September, we start taking the first dose of anti-malaria, because at least a week before you get there. So that's the time, really, even if you have, you can miss the rest of the meetings from now until then, but August meeting, if you're going, please come in, because I want to make sure you are there, you voice your concern. I need to help you fix it quickly before we get there. I don't want to find out that, oh, I don't have the visa the day that you are leaving. I don't want to find out, because if you don't, yes, you might be able to get the visa in the country, but then you have to stay in the airport for a while to get that process, while everybody else has already done that part. So we try to avoid the stress, because it's going to be stressed out while everybody else have to go and continue with the stuff, and then we leave you behind with somebody else to try and help you. So if we can, please make sure you attend that August meeting. Individual health clearance, definitely talk to your doctors. We're going to give you from the CDC recommendation when you're traveling to Tanzania. That's an open public information. When you're going to Tanzania, these are the things that you should have to protect yourself health-wise. And then all the immunization, majority of them you have had already. This is just like hepatitis A, definitely. If you've never gone outside the country, you're going to need that. That's just because of the food. You're going to drink different type of water because you're not used to it. We always give water, bottled water everywhere you go, but still they're cooking the food with it. So we want to make sure your stomach can handle that. So usually we have some medication with us. And then of course the doctor is going to give you those medication. You get those medications before we get there. So there's a lot of information that we need to make sure. All these forms needs to be done. All the payments should be done. So we make sure when we go there, we're just doing the work and everybody's enjoying their time versus being stressed out that, oh, I don't have this, I don't have that. Okay, he's gonna let me go. There we go. Okay, so for the insurance part, so this is the part that the form, we give you the link. Don't worry about that, but we give you the link. Once you get your ticket, we give you the link, and then you go and buy the travel insurance. So this is not only travel for flight, we want to travel medical insurance, meaning that if you buy with the ticket, the travel insurance, that means if they cancel the ticket, that's it. If you get sick, we can't take care of you, like people paying for it because you did not get the insurance. We want to make sure when you're buying the ticket, don't buy the insurance that come with the ticket, but to go to this one of the website, those are international websites that cover the flights and the medical. So just in case, God forbid, you get sick over there. So then we take you to the best hospital that the travel insurance they've already identified for the foreigners. And then if we need to airlift you back to America, then it's covered, that prices are covered in there for emergency flights. So then you come back as quick as we can. We want to make sure that the medical party is there because just in case you get sick. So far, we have never have anybody who has to use that, but yes, and the price is not that crazy. So it depends on how much the ticket price is. So as I said, most of it, I'm going to give you a few minutes to the prices. The ticket has been close to $1,200 to $1,500. So then, according to your age, the medical insurance is going to be probably between $25 to $100. It depends on what you need included in your insurance, which I'm going to give you the next page here. So when we do the Qhsc International is one of the insurance that we always use. We've used this for about 3 years now. But it doesn't mean that this is the best of everybody else. No, you go in there and choose whatever is safe for you. As long as you have triple cancellation, that's the middle column I'm reading right now. Triple cancellation, triple interruption, medical evacuation, medical emergencies, baggage loss just in case, and then flight accident is not covered, but accident, that's option. You can upgrade if you want to do that part. Most of the time, if you have 1, 2, 3, 4, 5, those can cover everything else. We don't worry about the rest of the stuff. But as I said, you can maneuver and choose another a program that has different things. Because I think this one's has, they're both the same. The Qhsc International has an accidental death update program. If you need to click on it, it's going to cover more money. But as I said, that's up to you. But at least if you're doing it, please make those the first 5 on that option there, because just in case we know anything can happen, the flight can be canceled, or maybe your connection flight can be canceled, you're delayed. We want to make sure that you are covered so you don't have to start paying out of the pocket. And you can see triple cancellation, they pay almost $1,500, which is kind of, I put the maximum amount of the ticket. And then medical evacuation, definitely they're going to give you up to $250,000 per person to make sure you get the care and then you come back to United States. So as I said, you can try, when you put that, the quote, then they're going to give you almost like 8 of them. But I've used so far the Qhsc International. I've never had any problem with them. You communicate with them, they respond very quickly. I've never had any problem. And the people who have used it before, they've never had any problem. So as I said, you still can choose any of them. I mean, I'm not going to restrict you from certain times. Some people add more stuff here. So yes, the money is going to be more. But the money is only one time. And it's covering only the time of the medical mission. So traveling, so just in case they ask you for traveling date, you put the 13th to the 29th, because that's the 29th you'll be arriving back to United States. And then of course you give them the date and the time of the ticket if they need to confirm things. So as of so far, we've never had any issue with them. They've been very supportive, but I said we've never used that services because God have been blessing us and we've never had any issues. So far so good. But we always have to make sure we're prepared just in case if it happens. So your family also is aware of, like, something happens, then these are the things that we have it in place for your safety. Okay, so the flight. So as of now, we've settled down with Emirates. So I know sometimes the people from different states, different country may decide to go to a different airline, which is okay. But so far, we used Emirates last year and everybody liked it. So we're going to keep the same. There are other options that some of them are a little bit cheaper, but the service has not been the greatest. But as I said, still people are allowed, you want to do the investigation and use a different airline, that it's okay. But we usually have one agency who try to coordinate all the flights from all over the places that people wants to come with us. Sometimes people coming from the UK come with us. They always help with the one agency, and then she tried to synchronize all of them and make sure we arrive in Dubai, all of us at the same time. Then we can go to Tanzania together. Okay, so everybody can see my screen, right? So far, the people who are coming from Miami to Tanzania, then the range is 1350, so 1350. You know, sometimes they have the taxi and tips and stuff, so that could go up to 1500. As of now, for the Miami people, it might be like 1350, as I said, plus taxi, and sometimes we give a little tip for the guy who help us because it's hard to synchronize for 30 people to make sure they fit on the same airline. But and the sooner we buy it, the cheaper it's going to be. The longer you wait, then the price is going to go higher. So that's just an average. That's why we put like between 12 and 1500. Sometimes if people are coming from JFK or they're coming from bigger city, DC, then their flight might be cheaper because their airport has more flights going to Dubai versus other cities that they have less flights. Or if you're connecting inside the country, it might be a little bit more than that. But so that's where the variation comes. But the sooner we get the ticket, the cheaper it might be. Okay. Okay, so the things that we need to do, definitely if you are decided to go to Tanzania, then make your information known, register on the website, and then $250 deposit. This is non-refundable because as soon as you tell me you are going, then I have to start making arrangements in Tanzania to make sure for the hotel, for the shuttle, for the transportation, for me, all those things I need to say, I have 25 people, I have 30 people. And then most of the time for them to make sure that we are not running away from it, I have to give to put a deposit, and deposit is always a certain percentage of the people who are going. So that's why we have to do that, just in case later on you change your mind, some emergency happen, that also the money has to be given ahead of time. So I can't, if I give you, refund everything back to you, I'm not be able to do that. And then so when we get close to the July, I think 20th, maybe there's a next screen, July 20th, by then I have to pay full fund. For example, we're gonna do the safari. So those are the things that I have to be paid ahead of time before you get the service. But anyway, Tanzanian logistic, that's amount that you're gonna be paid for all the services gonna be provided in Tanzania. Individual expenses, those are the ones like if you want to shopping and stuff, that one is not included. You're going to take whatever the money you have. Most of the time so far, people have told me between 300 and to 500 max, because they have to buy souvenir for their family member and stuff. But those are, if you don't want to buy anything else, you don't have to spend anything else other than the 1500 for Tanzania logistic. The language, of course, Duolingo. I know there's a lot of people are going to start talking about learning Swahili, just basic things, greetings to say, where's the toilet, or okay, I need some water, or I need food, or I got lost, or whatever. Those few phrases that will make sure, just in case if it happens, at least you can say a few words and people will know what exactly you mean. And then, of course, for your safety, we stay in the group. And then we're going to share a little bit of the testimony for people who have been there already. So at least you have some idea what exactly can happen. And then, of course, the accommodation, transportation, all those things will be covered with that $1,500 payment for the Tanzania. We are going to stay as a group. The hotel is called the Maj Hotel. That's in Dar es Salaam. And then, of course, sometimes people ask me the length of the workday. So if we are going as a healthcare worker, more likely we'll be leaving close to 6 o'clock, leaving from the hotel, go to the hospital, because we want to get there at 7 o'clock to be able to get the report and be able to see patients, or go to the unit and start teaching. For the people in school, the school started at 7, but usually at 7 started cleaning and all stuff. So still maybe leaving from the hotel because it's very close to the school. So chances is you might be leaving close to 7:30 or so, and then get to school at 8. But that school also can vary because it depends if your activities start at 8 o'clock or 9 o'clock. We are going to see the parents. So, but we give you daily updates. So if we finish a day, probably dinner time, we share what we're going to do tomorrow morning. And then tomorrow morning, for people, each group, we say, okay, we're leaving at this time. We need to carry this. We're going to do this training. So we have those stuff ready, set to go there. Other than this information, yes, the ticket is going to depend on when you're buying a ticket. And then the visa is always $100. And then the insurance, that part is on your own to do it. And then, but just let me know. So for planning purposes, we're always trying to know how much you're paying for your ticket and how much you're paying for the Tanzanian logistic, to make sure we try to keep everything less than 3,000, because we don't want people paying so much money out of the pocket. So we try to organize things to make sure that it's kind of affordable versus charging too much. You can ask other medical missions. You see the prices, I mean, close to $8,000 or $9,000, but we are not going to pay that much money, because that's a lot of money for people to use their own expenses to go to do a medical mission. So we try to keep the costs as down as we can. Buying things in group help us afford it to be able to get the discounts. And that's why once we make those reservations and give them the deposit to say, yes, we are coming. So then they have to hold those dates without putting other people. And that's why we're getting those discounts. Buying individual like accommodations, it's going to be more expensive to do that. Okay, so then for the shipping part, once you commit, and we're trying to cover which project you are going to donate with. So those are the things that we need to be able to send the surprise to the shipping guy. So definitely most of the time we want to collect money, but I know that some people who wants to donate, they want to donate items. So we don't want to discard that part. Yes, we're going to take those, let's say the baby blankets. If people wants to donate the baby blanket, sure, we take them. But if somebody's asking you, do you want the item? Do you want the money? So more likely the money, because if we get the money, we buy and send it to the shipping person who is in Maryland and help us to ship it to Tanzania. So of course the shipping takes time, and that's why they need to ship the stuff out of the country by May 30th. The problem is we need to get the stuff and send it to them. So we want to make sure the first week of May, that gentleman receive all those stuff. So at the end of the month, we have only 17 days left. So we have to really get to do stuff within 2 weeks to get these things going and make sure that we have enough supplies for all these projects. But we need your help. So whoever wants to go to select a project and then, okay, I'm going to work with this project, I'm going to ask you really to help us within those 2 weeks to try and get as much as you can and send it. Yes, probably sometimes people might still give you stuff after the May 30th. There are some of the things that we take with us. So that's where the next thing comes. You're going with each ticket, you're going to have 2 check-in bags. So those are 50 pounds each for free, because it comes with a ticket. So we always ask you for all the volunteers, you're going to have the check-in, so personal item, maybe the purse or whatever, and then the carry-on bags. So that's the carry-on bags you're going to be with you, traveling with you as you go to Tanzania. And then you're going to have 2 checking-in bags. So those 2 checking-in bags, one, you can put your items and stuff for yourself for stuff we're going to use. And then the second one, we're going to ask you to put the donation stuff. So whatever you collect, if you don't submit them before the end of April 30th or the first week of May, then we ask you to gather those things and keep with them, and then use the second bag with because it's going to be free and travel with it. And then once we get to Tanzania, then those things can be taken to the hotel. And then we're going to sort it out to make sure which project have what. And then we start distributing when we go to provide those care. But I said, we're going to get more information as soon as you commit. Then we're going to walk you through the process and to try and see which project you're going to be beneficial for you also. So we want you to do something that you're passionate about. Or if you're passionate just volunteering, then we can put you anywhere else. Sure, we can try to share that much. Just in case if one project has 15 people and the other project have 2, I am going to ask you to move around and share that responsibility so we can have all the project balance versus one is higher than the other one. But all the projects have its own meaning and own significance for the medical mission. So we're really going to ask you to help us cover all these projects. But you can see there's a lot, but we're trying to cover your interest also. We're trying to provide those services because in one way or the other, they're connected to each other. Okay, so the cheat sheet. Now, this is the one that I'm going to also post it in the group, the Qhsc group. And for the new people who sign up and you're not in the Qhsc group, the WhatsApp group, let me know. We're going to add you to the group. Or if you can put your number in the chat that has WhatsApp, and then one of the my facilitators will help me to add you to the group. right, Bree and Dr. Siakabe? Going to help me. If somebody is in this meeting
Yes.
and doesn't have, is not in the WhatsApp group, Qhsc WhatsApp group, please put your number in there and your name so we can add you to the group, and then you get all these updates all the time in the group so you know what is happening. So as I said, the preparation is, for now, you should have a passport now, because if you don't, more likely it might be delayed, because it's gonna, usually sometimes it takes 11 to 12 weeks if they think the trip is on September. So they might think it's later, but we want to make sure you have the passport, because next month in May, we're gonna start getting the visa. And as I said, the visa is $100. And then, of course, the CDC, that information is going to be posted as soon as we start recruiting people. I'm going to post in the group what medication you need to get. And then, as I said, your provider can even search that information from the CDC website, but we'll help them that they don't have to work for it. We give you the link and a screenshot of all the medication that the CDC is recommending. So you're going to go and say, here, I'm going to Tanzania this day. These are the medications that are recommended. This is when I need to start taking. So that the provider will be able to order those medications for you. People usually ask me, what should we pack? We always encourage you to pack scrubs for the people, healthcare workers, and people even who are not healthcare workers. Some people want to wear the scrub, which is fine. We try dark colors. We don't want like white because it's going to get dusty very quickly. We don't want like magenta green. That's so bright. We want just the dark color. So the navy blue or black will be great. Gray is troublesome because sometimes it looks like almost it's like worn out. We don't want to try to stay away from gray. So we want dark colors. So dark blue or black will be just fine. Even if people who are going to school, even if you wear the black skirt or black pants, that'd be fine. Definitely cover your toes. We don't want people with, like sandals. No, we don't want to sandals because you're going to get hurt or something, stabbing or whatever. And there's so many things that can happen. We always want to cover the toes so at least we look more presentable. Everybody's going to get a badge. Everybody's going to get a t-shirt like this. So you're going to be like everywhere you go around the school or the hospital, everybody will see how you look like. So just in case if you get lost somewhere, they're going to be, are you looking for that group there? At least to make sure you're safe somewhere, everybody knows where you are. So we do things looking similar everywhere we go. And no jeans, no yoga pants, no those cut-off jeans. I mean, I know the young people like that, but that's for the professional purposes of the group. Please don't wear that. If you want, you can pack and then wear in your room. That's okay. I don't care. But in the public place where we are going as a group, we want to make sure we are presentable and people can take us serious versus seeing us showing our bellies or whatever it is. That's not acceptable. And I don't want to start fighting with people saying, okay, that's not acceptable. I don't want to do that. We are all adults and we want to be able to go and present ourselves as useful members of society, so to help the other people. Local expenses, we hope to collect by July 20th. I know sometimes people want to do installment, which is fine. I mean, whatever works for you, that's fine. Some people will say, okay, I want to give you money, then I don't have to worry about it. That's okay also. So as I said, that is going to be an individual conversation. So we can discuss it with you exactly how much you need to be able to give. Whatever the 250 that you're going to do after you commit, that is going to be added to whatever it needs to do for Tanzania. So it's not like the 250 is separate from the 1,500. No, it's included in there as long as you're going with us. And so if you give the 250, then definitely 1,250 also is going to be added to that 250. So you'll be covered. The electricity, just be aware of people who wants to buy the iPad or something that can listen at night or whatever. Just make sure that you have an adapter. We're going to share the pictures of adapter. We have the Amazon pictures where we always buy those adapters. They're very cheap. I think it was like maybe, I don't know, $12 or $15. I don't remember. That was last year. But we share those pictures with you so you can buy the right one so you don't burn all your equipment. Never, never, never connect your device from yours to the wall, never, because you're going to blow up your stuff. So don't do that. We always have the real adapter with us. And then some people get those power bank with you. So you charge in the hotel and then, yeah. So the hotel has a Wi-Fi. Yeah, it may be temperamental sometimes. We all know that. So the public Wi-Fi, it might not be as stable, but you can have the information. You can have the services connected from here. So I have AT&T. AT&T has a day pass, which I believe is like $10 a day. They will charge you for, I believe, 10 days. And after that, it's free until the next month. So we are always there at least close to 14 days or 13, 14 days, it depends. So I do that, and then I use the phone as if I'm here. Like I call, I use it surf the net, I use it as a hotspot. So I use it on my computer for the internet, but I used my AT&T. So if you have a service provider that offer those project services, sure. We have people who've gone through medical mission. They've used their own ways that works. If there's another thing like that, please ask the questions in the group, and then people will share what they've used before and what works for them. So maybe the $10 per day might be too expensive, which is okay, but still ask the in the group, and then the lot of volunteer, we might have a different option that works for you. Yes, Dr. Siakabe?
I was gonna say, maybe in about another week or so, I'll post a link for the adapters in the WhatsApp group, probably an Amazon link, because that's where some of us will buy it from. You can also find them at Walmart in the travel section, and I think Target has a travel section too. You can probably find some there, but I'll post the ones from Amazon. And then also, if you can, I usually bring a mini extension cord with it has you know, maybe 3 outlets on it or something like that, because you might want to charge your phone. Maybe you have a laptop or something else. So it kind of gives you the option to plug up a few more things. That's it.
Okay, no, thank you. And I see a chat. Is there anything in the chat? Or just greetings?
I was putting the QR codes.
Oh, perfect. Thank you.
Mhm.
Okay, so this is an example of what we can, once you make up the decision that you're going, that's what we're gonna do as an individual. So I put a template like for if I'm the one who is in here. So the lunch for 13 days is calculated right here. And then for the accommodation, like the hotel is calculated right there for 13 days for the safari. So we are going to go to the safari. So I can't like announce quickly because I have to have either at least 10 people or 20 people, because then I will tell you the prices. So as of now, if there's at least 10 people are going, then you'll be able to pay. If you're gonna use one person, it's gonna be like 540 per person. And then if it's a couple, it's gonna be 465. So you get a discount if there's couple, meaning like the room that you use for 2 people versus only 1 person. And of course, where we are going, the camp we're staying is not as big. So if there's a bigger group, more likely they encourage people to share a room. Sharing a room does not mean sharing a bed. Share a room like there's 2 beds. So if there's friends among you, and then you want to share a room, that's fine. That means you're going to get some discount. So that's why I said when you hear me keep saying that Tanzanian logistic is going to be around 1,500, because if you share a room, then your flight is cheaper. And then for some other places, then there's a discount. Then you're going to find that you are paying less than 1,500. So that's why this is an individual. This is just a sample. When we get to the point, it's going to be break down exactly what you need to do. And then in the travel part, we're going to try to go out so you can go and taste what Tanzania food outside places, like a nice restaurant and stuff, so you can see. We are going to the safari, as I said. It's a national park, so people who wants to see live animal, not caged animal. So if you want to go and see that, and I know some people already start jumping up and down, so you will be able to go and see that. So we'll be spending a couple of days over there. There's a couple of things that I need to leave for the surprise. You have to be able to be surprised. I don't want to tell you that, but it's going to be fun. But yeah, so just know that you're going to see animal. Which ones? You're going to have to wait. You have to come to the medical mission to go with us. You have to work first for 4 days and then go to the medical mission. So that's the sample. But when you, right now, it might not make any sense, this breakdown for individual expenses, but once we started talking to you one-on-one, it's gonna make sense. Because right now it's just a sample of, and it's gonna be moving around according to what you have. Because let's say if you are younger, like some people here, their travel insurance is gonna be less. Some of us who are seasoned, and experience, our insurance is going to be higher in life. And then, as I said, if you're sharing a room or if you're husband and wife, then definitely you're going to have discounted because you're sharing the room versus using one room. The same thing for the accommodation in the hotel. You're going to get a discount because you're sharing the room. You're not using 2 rooms, you're using 1 room. So as I said, it's going to be a lot of discount here, discount there, at least less than 1,500. We're going to try not to get anybody above 1,500. As I said, we have to do a lot of discount and help to make sure everybody doesn't spend too much out of their pocket. Okay, so this is the last credit, then I'm going to open up for everybody to discuss now. The fundraising part, as I said, once you identify the activities that you're going to do, let's say you do Help Baby Breathe, can you help us raise money and buying those blankets and little hats and the booties and onesies and stuff? If you're doing postpartum hemorrhage, can you help us buy the scale, the pad, the underpad, the chucks, or anything that we need for postpartum hemorrhage? There's a lot of pads we need because we want to make sure every woman who is there, delivery while we're there, we catch their blood so we can do the quantification of blood loss. And then if you're interested in that project, yes. For CPR, we want to buy those 2 family of the CPR family. So you get 2 adults, 1 child, and 2 infants. So at least it is easier to have 5 stations to teach a lot of people every day, because we want to make sure each person gets almost 15 to 20 minutes of practicing the CPR and stuff. And then they're going to have the theory part before we get there. But when we get there, it's just going to be skills validation, skill validation. And that also requires enough resources. We're going to do 2 hospitals and go to the schools and go to the soccer club. So we're going to need those 2 family of mannequin. And then 1 family costs almost $1,000 just for the mannequin, and then the accessories and stuff, it gets up to $1,800. So we say almost $2,000 for 1 set. So if somebody is generous enough, wants to give us $4,000, that would be great. We can get 2 families. So then 1 hospital get their mannequin family, and then another hospital. So when we teach them, once we leave, we want to ask them to continue practice that quarterly to make sure that the nurses and the doctors stay active so they can save the patients' lives. And of course, for the school, if we are able, definitely, we need to be able to offer those training, especially for the older kids, so they know what can be done if somebody faint. They can go and help in the community. If somebody faint, at least they can identify who is in trouble, and then they can help them with that. Okay, so for also another fundraising way, we have a shop. It's called the Qhsc shop for the Qhsc. We have all those t-shirts, like the one I'm showing you, all the mugs, the cups, the blankets, the stuff like that. See my pillows? So for the Qhsc, I have my blanket over there, but somebody's gonna laugh at me. Socks and whatever thing you want to design, the sweatshirts and whatever, if you want to buy those things, the hoodies when we went to Tanzania, and we're going to start asking the people who have gone to share in that, so you can see what you can buy. So everything that you buy is going to support the Qhsc. Percentage is going to go to the Qhsc to help facilitate and sometimes lower these prices that we're doing to support people who are volunteering. And then complete the mission. So there's a lot of stuff that's going on in there. So if you can help us, yes. I'm going to show you these little pictures, like there's 5 of them, and then I'm going to be out of the sharing screen so you can see it. Last year, these are the, I think some of them, we're missing.
I was going to say, Bree's going to put the Etsy link in the group chat.
Oh, perfect. Thank you, Bree.
Doing it.
Okay, so yeah, so this is the group. I don't think they're all of them. Probably a couple of people are missing there, or 3. The group in Tanzania were not there. I only see Mr. Masha there. But yeah, so the group from US, it was there. So you can see everybody's wearing a t-shirt that identified them as a Qhsc. They have a badge. The badge shows your name and the credentials. If you are going to the hospital, going to the school, you have those things there. So we have that group. And then we have... these are the children when we bought lunch for them. So they bring their own dishes to have lunch. So they pack those plastic bowl and to school. So they line up during the lunch Remember, if you look at the right side, you see your darker area, that is the cafeteria. So you can imagine where the food is being cooked at, but whatever they have, the resources they have, that's what they're gonna use it. So it's really, painful for me to think about going there, try to teach them sports and health, promotion, disease prevention, and then don't give them food. Why we are going to sit at lunchtime eating lunch, why they don't have anything to eat. It's very sad, but we try the best we can. So far, we have been blessed to do at least 2 to 3 weeks for lunch for them. At least they will eat lunch and then we continue learning with us. And then so we had a graduation last time, so we were able to see the 7th grade that they were graduating. They were so happy because we saw them a previous year. Now they were graduating, so everybody was happy. We were able to dance. There's more videos that people can start sharing again to give them an idea of when we go to this school. These are the key that I said, and the limited resource area. You can see how clean. They might not be the cleanest clean of white, but at least they're washed those clothes, and to see them, they're so happy to be at that place. They have no idea. They don't even see their challenges as obstacles. They see them to be in school as an opportunity to get to be better. So if we are able to go and help them make their dreams realize or think even beyond of their troubles, that is one thing that we can inspire and make their life better. And then this is one of the group that when we were doing the training for the one of the hospitals called the Kilo Hospital, military hospital. So you can see we're getting ready to do CPR training. We're setting up the stations. So it's always once we hit the ground running. Everybody's doing stuff to get ready. Like I said, setting up, and then the nurses and the doctors and the officers were waiting for us to set up so they can start learning and practicing. So we did it for 2 days, the training, because after 1 day, it was not enough. We had to do 2 days of training. So that's only the video. I mean, there's so many videos we can share. This was 2021 when we were teaching prevention of postpartum hemorrhage using the quantification versus estimation. And then so half of the people did estimated closely to the amount that was on the pads, but the rest did not. That's proved the point that we know for sure, if you work in labor and delivery or postpartum for a long time, your eyes are gonna be desensitized of what you see in front of you, hence ending up underestimating the blood, thinking that is just minimum because you see it all the time. The problem with that causes the delay of care, because if you don't think this patient is at risk for postpartum hemorrhage, they're going to end up start bleeding by the time you realize they're dead. So these are things that we need. The least we can do is just to try and give them objective way of assessing these moms and save their lives. And then lastly, join the mission. So definitely, if you're ready to join the mission, please go to the website and see what you can do and come and join us. And then with that, I am gonna say, when you start filling out those forms, send them to info.drgabone@qhsc.gmail. So all the leadership people have access to this account. So then as soon as we get that information, we're gonna start talking to you and get your information settled, and then you can get you to start selecting projects, start getting ready for the medical mission. And of course, another way of joining the Qhsc, you can be a member. So the members have the fee. So the leadership members pays $150. That helps the everyday function of the organization. The regular members pay $75. That helps. It's an annual contribution. That helps to, again, supporting the mission, paying for the Zoom that we are on right now, paying those everyday things that the Qhsc needs. And then for students, they pay $50. So if you have that, then usually it helps to, again, show your dedication that you're trying to support this organization and then help the functions of every day. And then on top of that, I'm just gonna say, I'm gonna stop sharing my screen. And then if people can come online, and then we can start discussing with them. If people have questions for what I've discussed before we start doing the testimonial, that would be great. Anybody? Any question for what I said? Was it clear? Or maybe? Anybody heard me?
It was clear.
Are you sure? We have so many people in the line. Oh, Miss Tanya Rice, she's here. Any questions, Miss Stephanie? Miss Irene? Oh, Dr. Adelaide, how are you?
Doing well, and thanks for all you do. And we'll be in contact with you to get more information.
Okay, that's good. That was my colleague from from Ohio. Wow, I'm so happy to see you there. That's very good. Are you planning to come with us?
I'm thinking about it, so that's why I'll get with you.
Okay, perfect. Thank you very much.
Yes.
How am I with him? Mrs. Irene Gabone. I
Yeah,
can
I was just
see.
about to say, Irene she just raised her hand, so I think she has something to say.
No,
Oh,
before she say anything,
that's
sorry. Before you say
Oh.
anything, Miss Irene, do this. Can you stand up a little bit? Yes. Do you see
Yes.
the jackets, the hoodies?
I
Yeah,
have my Qhsc hoodie and I love it.
that's good. See, it keeps you nice and warm upstate New York.
I know. We're still having the low temperatures here, so this is
Yeah,
nice.
as long as she stays in the house, she'll be warm.
No, she has the Qhsc hoodie, then she can go outside. She's covered.
Yeah, so it was a nice meeting and I think everything is clear. So I hope more people get to go.
That's good.
Unfortunately, I don't think I'll be able to go.
But also, okay, you're excused. At least you have a hoodie. That's okay. You're excused.
Good.
No, thank you. Thank you. Anybody else? Questions? Miss Tanya? Stephanie, please.
I don't have any questions, thank you, but I'll when we come up with stuff, Bill's here with me, my husband, we'll let you know, we'll contact you.
Hi, Mr. Rice, Bill.
Hello.
How are you?
I'm fine. I'm fine.
So are you ready to go? I'm ready. Are you?
Oh, yes. Oh, yes. For sure.
That's good. I'm glad you both I'm glad you guys both are able to come in and listen in, but we are very excited. My husband, Dr. Poranka, is right there, and my mentee, Miss Bree Vegas, is there. She's following me everywhere to make sure I'm doing the right thing to recruit people. So any questions, definitely in the group. If you guys have any questions, yeah, so they will help me to do that. Miss Valentine she was
Well,
not able to come in, but she always also come and help. Yes.
I have an engineering background, but not a medical, so I don't know if you can do anything with me.
Oh yes, plenty. In fact, I know my husband probably wants to jump in and say something, but yes, for the engineering, for the school, we really need your help. Probably we may talk afterwards if you have a minute or so after the meeting. We can talk. There's something else for the school. Might need your expertise to explain. However, we can put you anywhere else. We have a lot of people in school. Probably I'm going to let my husband explain that, but that we can use your help. There's a lot of program you saw that we may use people with your experience. Yes,
Okay, thank you.
You're welcome.
Coaching?
Mhm.
Oh, yeah, and I coach sports too, but I don't know if that helps either.
No, definitely. We have the sports program, and we like last year. I mean, suppose you want to explain the sports that you did last year with the kids at school?
We just basically did like some training, a little light conditioning or drills using cones and hurdles or whatever, stuff like that. They play a lot of football or soccer. We actually took some frisbees, and I don't know if they've ever played with frisbees before, but they went nuts. They were like fighting over the frisbee and stuff like that. I mean, we had a few of them, but anytime that frisbee went up, when it came back down, there was like feast or famine. So just introduce them to different things and stuff to get them out there and let them do a few different things or different activities and stuff like that. But the main thing they do is football. I don't know if you played volleyball or anything like that, but we have a volleyball net there too. We didn't use it last year, but So we just try to just to get them going and give them kind of more of like a structured PE or something like that. And then this year we may look to see if we can organize a football team, a soccer team that is, and see if they can play against a organized, a real organized team and see how they fare. We're even thinking that they may play a younger team at that, because that team, the one that we usually visit, the Magnet, those children have been practicing for years. They even travel internationally sometimes, so they're really good. The kids at the school, they're good, but I'm not sure if they're as organized as the Magnet players. So,
Well, I coached American football, and so I don't know about the soccer, or for lack of a better word, the other rest of the world football. Don't know much about that. I watch it from time to time. Um, Volleyball, yes. Basketball, yes. Baseball, yes. And that's about it.
okay. And then we tried to start something with basketball, but they just don't have the resources there. They don't have like a rim or anything like that. So
Well, they started out with a peach basket, so
that's right, or at least a ball dribbling and stuff like that. But yes, but there's always stuff to do at the school. So we support them in terms of academics, or if there's vision screening going on. I'm not sure. Well, we may be doing something with vision screening one way or another. So, and then also we're going to try to do more of like a career day. So you could maybe even speak to students about your career, your trajectory, and when you said that you were an engineer, my wife was like, "Oh yeah, my husband's going to want to talk to you." So I've been dying to get like an engineer or someone to go there and just to teach them the basics of electronics or computers, just to kind of these are elementary kids, but elementary school kids, but if you give them like an introduction to stuff like that, so then they know, okay, well, this is how technology works. Maybe I could consider working in technology, or even becoming a computer scientist or an engineer or something like that. So
yeah, radio communication is my discipline.
oh wow, okay. So you can teach them about bandwidths and stuff like that,
Oh yeah,
or radio
yeah,
frequencies.
yeah, wavelength and ham radio and that kind of thing.
Yes,
They would
yes.
love
Oh,
that.
yeah, that's interesting. Yeah,
Now,
that's interesting.
make sure I'm there. I want to come and listen too.
You'll
No,
be with me in the hospital telling me what to do.
no, I will show you in the morning and run to that. No, I'm just kidding. No, but I mean, definitely, they need something to inspire beyond. Because remember, these are the kids that I even willing to bet that probably less than 1% of their parents have been at a college or going to do a professional those responsibilities. So they don't have that exposure. So if you give them that idea, the mind of the child, if you give them the idea and you plant that hope that I want to be an engineer. So giving them that hope, it might inspire them to say, okay, I need to study hard, even if I have all these challenges. But we're not going to solve all their challenges. We're not. But at least in their mind, if they're set up to do better, and then they see themselves, okay, oh, I can do that. So you show them little wavelengths or bandwidth, whatever you're talking about, and then they see that excitement, then they'll be like, okay, I need to push myself to do that. And that's what we're trying to do, just to inspire them to think beyond their challenges every day, because yeah, they're going through quite a bit. But these kids, we see them as happy as they can be. Somebody comes to school without eating breakfast, but they're smiling. They're not even thinking that, oh, I'm so dehydrated. No, they don't think of that. They play until they pass out because they're hypoglycemic.
I
They're
have a
just happy to
couple.
be there. Huh?
I I have a couple handheld radios too. So that's something that you could demonstrate, how it works and talk about the things of that.
Oh, they're going to be
Is that
following you
something
everywhere.
yeah. Then maybe I'll bring those.
Yes, definitely. No, you are muted, Miss Bosa.
Oh, sorry. I was saying breaker 19, breaker 19. This is Lone Wolf to Den.
The problem is that on certain frequencies, you have to have a ham license to talk, but you don't need it to listen. So if I'm broadcasting, they can listen and then they can move away a distance and be out of sight, and they see how the different propagations, how waves propagate from different areas and such. It could be a fun little thing to do.
Oh, it'll be so much fun. I'm sure when you're thinking about it, just remember you probably have to do it for everybody. Because as soon as one class know that there's people are listening to the radio, the whole school is gonna be on the window looking at you and be like, okay, can we do it also?
Now, these radios that you have, where did you get them from?
They're Baofeng. Got them on Amazon.
Oh,
Yeah.
Who did you say they're by?
Baofeng. Baofeng. Baofeng.
Aren't they just like walkie-talkies? I don't know nothing about this.
They look like walkie-talkies, but they're actually shortwave radios. They're really small nowadays. You can have base stations and you can have mobile stations. There's all kinds of different.
Oh, okay. No, that's good. That's good.
Yeah.
Yeah, because I believe you me, I know about the little walkie-talkies and stuff like that. So that was a big thing for us when we were growing up. Oh my God, a walkie-talkie. And we had those little handheld radios. We listened to transistor radios for music. We didn't even have boom boxes back then yet. So.
Oh, you're telling on yourself now.
The little strap that went around your wrist and you can hold the radio, listen to even the AM or the FM radio stations. Yeah.
Yeah, when I started, there were vacuum tubes. I probably don't even know what that is.
Yeah, I know what they are. I just didn't really see them.
Yeah, that's when they started talking about solid state. It's when they transitioned from vacuum tubes to what we have today with ICs. Transistors and stuff. Your transistor radio was that.
Yeah.
So it's interesting. I think there's enough.
no,
I think there's enough to keep people interested.
no, definitely that would be like to spark their interest. Definitely when I want that. Because I mean, they get so excited with just very small things because they've never had anybody give them the time of the day to show them things that could be better. So they've never seen that part. So anybody who takes the time to go and show them, they're going to appreciate that. And that is going to get so excitement there in the school, that much for sure.
And then what's your name, brother?
Bill?
Bill?
Yes.
And that's great because then while we're on safari and you guys are like at the other end of the park over there, if we see anything that we're concerned about, we can just signal you on the radio and let you know.
Well, that would work if I wasn't on safari.
I'm just kidding. I'm just kidding.
You'll be sitting next to you right then. You'll be like, no, I want to see that.
You're like, that elephant looks pretty angry. I think you better get out of there.
Remember, we have a small ranch here, so anything to do with animals, we're going to want to see.
Oh, God. Okay, no, thank you guys for coming in there.
Thank you.
Yeah. Hey, how are you?
I'm good. How you doing?
I'm good. Are you coming with us this year?
I'm thinking about it.
You
I
should.
gotta see what I can do.
Yeah, I need
I gotta
somebody.
see if I can get this time off.
I know we need somebody for the added to the postpartum hemorrhage.
Oh yeah, I see a lot of that.
Yeah, you have done the project, the Qhsc, sorry, the quantification blood loss. You've done that, so we need help.
Yeah,
Yeah.
I've done it. Do it a lot. We just had one recently too.
Oh no.
Yeah, the other night.
Oh, Mom okay though?
Yeah, Mom's fine.
Okay.
We gave her every drug box that we had.
And that's true, but also think of in Tanzania, they don't have all those drugs. They don't have methadone.
No, they don't.
They have
They don't have methadone,
No.
CXA, they don't have hemabate.
You're being too fancy now. No,
I know.
so that's why I said,
Well,
I want people with all this knowledge you have, you're thinking all these drugs, now you have to think of an alternative. If I don't have these drugs,
right.
what things should I do
What
to
am I
help
doing?
this?
Right. Yep.
Yeah.
They,
So
they don't have any of those things. Yep. Emptying the bladder, fundal massages. Yep. They don't have any of that.
last year we went with a straight catheter to drain the blood.
Yeah.
And stuff. Yeah. So that helped a little bit. Yes.
Yeah.
Because I said, since you don't have that many drugs, they do have Pitocin, but not necessarily that readily available to give to every postpartum mom. No, they don't get that.
Right.
So
No, they
we have to
don't.
do a lot of training, and like how they're pushing their patients. You have to screen them who is the potential. So,
Mm-hmm.
and then
Yeah.
they're delivering like almost 10 babies within an hour. So people, we need
Right.
we need more nurses in the room to be able to labor with each patient and support them that way. But it's hard. But
Right. It is hard because you
yeah.
don't have enough bodies to be there to kind of screen those patients,
Yes,
especially if they're multiples or they've had multiples or,
yes.
after been on long. Mm-hmm.
Majority of them are grand multiples. So then they're having babies very close, like maybe every year or so. So remember, there's no space to recover the body. And then they're going to
Right.
have a baby. And then they come sometimes the precipitous delivery. So all those risk
Right.
factors there. So you have to be able to
Yeah.
identify them and catch them. But so we do need
Yeah.
more people, yeah. And I was hoping.
Yeah. Do they do the postpartum hemorrhage risk on them or no?
What did you say?
Do they do the postpartum hemorrhage risk on moms there?
They try. They try.
Okay.
So that's why we have to go and educate, help them screen right before that. So we have more people to do that. And then before they start getting to be active labor, then yes, that would be great. But right now, because the volume is so big, they don't have many
Right. They
people
don't
to
have
do
enough
that. So
people.
yes,
Yeah.
so they'll be laboring outside the hospital, not being seen.
Yeah.
So if we have more people, then we have our own people to come and start talking and identify, okay, this is grand multiple, this is too many babies. Maybe they need to be seen here or whatever. So all those things, we need to have people to go and do that. Yeah.
Oh, okay.
That's why I need Stephanie to go with me. And Liz needs to come with me. Irene, she's running away, but yeah, she should come with me too.
Liz is busy. That's probably why.
I know, that's the problem right there. But so if you guys can share just a few minutes, a few stories of what did you know now that you did not know before you went to the medical mission? And then just to give them ideas, what are the anxiety that you had before joining the medical mission for people who have gone already? So then people, if they have those questions now, it will help them to make that decision a bit easier. Agree?
So my first year that I went, I was a nursing student, and I guess one of the fears that I had was I wasn't going to be able to know enough information in order to teach them properly. But over here, we know so much that any little piece of information that even if it's simple, they're going to love, they're going to learn from you and be very appreciative of that. So it felt very good.
Give an example.
I did postpartum hemorrhage my first year, and just the simplicity of showing them how to do proper fundal massage was extremely beneficial because a lot of them were doing, those of you in labor and delivery, were doing fundal massage with a flat hand versus upright. So just showing them the positioning of the fundal massage was extremely helpful, and we taught a lot of people that year. So that was pretty cool.
Yes. So, I mean, as I said, I always take the student with me. And then, as what Bree said, they always say, I don't know what I need to do. Oh, I'm not a nurse. I'm like, I know that. But whenever we always discuss before we go there, and then usually we use that layover at Dubai to be able to catch up. Okay, so if you're in this area, these are things that we have a lot of handouts that we give to the people who are training to say, okay, if you're doing CPR, this is the information that we expect you to share with. So we have a consistent message. So as I said, we're not going to just throw you out there. So if for the neonatal resuscitation or for the Help Baby Breathe, usually Dr. Msabichaka has documents that exactly we go, it's just almost like an algorithm for people in healthcare, algorithm. We just follow, okay, if the baby's doing this, you're doing this. If the baby's doing this, you go here. So everything else is lay out there. You're not going to start creating the class in your head. No, everything is already laid out for you. You just come and help. So you see maybe the person who is the expert teaching it the first time, and then you come and reinforce it. And then so, and everything, as I said, is in front of you. Like for the CPR, Bree created a document there supported by American Heart Association. So we are giving them an evidence-based information so they know what exactly to follow. And then so it's make it easier for people who, even if you don't have experience in that area, then it's not like you're recreating stuff, you're following what is everybody's gonna use. So consistent, continuous, and then help the transfer of knowledge and clinical practice. So all those things like check the fundus, where is the fundus? Is it bag, is it firm? How much is the blood coming out? Did you wait or did you estimate? Are your eyes correct when you're estimating? So all those things, we do it beforehand and then we do it with you. So when you're teaching, you're not going to be by yourself. Usually it's 4 or 5 people. You can see the video is showing you the CPR. There's almost like 12 people, global volunteer there, 5 stations. So each station has 2 people. So when you get a new person to come and learn, you can hear somebody else is teaching next to you. And then maybe the 3rd or 4th person you can teach. And that person is listening right then and there. So you're not going to be like teaching by yourself and say, okay, what happens? I forget. So all those things can be done that way. And then we support each other that way. So we're not going to leave you by yourself. No, we want you to share your experience. The first time you went, what did you learn after the first experience? What are your, I mean, if you had any anxiety before going the first time to help people make their decision right now?
I spoke with you and I told you I had been to Ghana before, Ivory Coast. And although maybe people think that everywhere you go in Africa is the same, I said I'm not going to worry about what I experienced or learned being on those in those countries. I was just going to kind of follow your lead, and it actually was different. It was a different experience. So I'm glad I didn't try to use one experience in order to learn from another one, because I think I got more out of that trip. I learned more. I was able to observe more, and I stayed more objective by taking that approach. So definitely learning a lot of Swahili, kidogo kidogo. So, but other than that, yes, I learned a lot. Learned a lot about the schools. Definitely learned about the hospitals. I don't really speak much about the hospitals and stuff like that because I let the healthcare workers take care of that. But if you haven't been to the hospitals in Tanzania, I know we were talking to someone who had been to Ghana when we were telling them about Muhimbili. Remember we were talking about like the bed situation and having to walk to the delivery room, and then the limited amount of time that you even have to stay in the hospital, the lack of nutrition, things like that. Even in some parts of I guess urbanized parts of Africa, they're not familiar with that either. So it all depends on where you go. So definitely the difference between Dodoma, which was the capital where we went the first time, and Dar es Salaam, and I always stress this, is that Dar es Salaam is a densely populated city. So even though you'll say, they have less resources and stuff, but they're still in the middle of a city, but it's just a lot of people there, and there's just less resources. So.
Thank you. So I'm just gonna trying to finish up with give you the idea of a typical days when you go to the medical mission. So we are leaving here on Friday. Some of you will be leaving on Saturday morning or Friday night. It depends on wherever you're coming from. So we meet at Dubai. So Dubai, there we connect to Tanzania. So we get that, either people will get there Saturday afternoon or evening. So when we get there, we're gonna rest in the hotel. Remember, everybody's gonna have a jet lag. So because Tanzania is 7 hours ahead of us, and then US is 7 hours behind. So when it's morning over there, over here, we're middle of the night. So it's gonna make yourself struggle. So my encouragement when you're traveling, definitely sleep. It's a long trip, but sleep so you can synchronize. When we wake up, when you are in Tanzanian time, it makes it a little bit easier. Otherwise, if you struggle and fight to try and keep on American time, you're gonna struggle the first 2 days while we are running around. Where you're sleeping, we are waking. When we are waking, you're sleeping. Once we get there Sunday, we sort out stuff, whatever the thing that we take with us, sort out to put in different programs, what we go where. If we have the backpack for school for the kids, we have to put all the pencils and whatever needs for school. For the hospital, which goes to postpartum hemorrhage, goes to help baby breathe, we go to ICU. All those things have to be sorted out the Sunday before we start. Because once Monday comes, we start working. So for the next 4 days, Monday, Tuesday, Wednesday, we work. Either in the hospital, either in the school, those activities continues. And we do all those things synchronized. So early in the morning, if we're going to Mwananyamala, all of us are going to be right there close to the hotel. So we go to Mwananyamala, study with the healthcare worker, drop them, and then go to drop the people for school. So for the hospital, we expect to go there before 7 o'clock, so we can hear the, change of shift report rounds and stuff, because that's why you get to know what happened last night and then what is going to be during the day, procedures, who is going to do what and whatever, how many people are going to be delivering, all those things. So if we are doing that part, for the healthcare people, for the help baby breathe, they might go starting rounds and following the babies who are born throughout the night to try and assess them. For the labor and delivery people, postpartum hemorrhage people, we go to labor unit to try and get to see who is delivering now, and then try to talk to them and identify blood pressure and all the stuff. We do our healthcare stuff, vital signs and all the stuff. And then for people in ICU, you follow Dr. Gwen to ICU and start looking for the vent people who are doing that anesthesia, and all the people in ICU, she continued doing that part. So the people in the CPR group, if we have arrangement, the room is ready. So the CPR group, maybe around the 8 or 9, they're going to start teaching the CPR. So all these programs are continuing at the same time. So that's why we said, if you go to each group, you stay on that group and do whatever you need to do in that group. And then usually we know, we communicate through the WhatsApp group. And then so we're going to know, like 12 o'clock, guys, we're going to eat. People in America are going to be seeing those hours weird, because we will say, talking about eating, you guys are getting up to go to work. So people be like, they're eating lunch at this time? Yes, just know there's different hours. So we try to communicate through the WhatsApp group, even to inform people in family members who are left behind, at least they know what you're doing. Because sometimes they might have issues to get in touch with you. Maybe your Wi-Fi is not working or something like that. They worry because they can't get in touch with you. Because most of the time, I always give up my information and the executive members who are there information, so that you guys can, the family member can get in touch with us. So it is, but most of the time we post everything through the group, so everybody, so we know, okay, the people in the hospital, oh, they're going to see a delivery, or the people in school, oh, they're going to play the game now, or if Mr. B. Rice is going with the radio. Okay, maybe the people from school, they're gathering the kids to start showing the radio or whatever. So the video we record, we start posting in the groups. The family member, we know what exactly we are doing at this time. So the group gets busy. And then so we always encourage that once you sign up for the medical mission, allow your family member also to join in at that time, once, especially when we're going to the medical mission, to know what is happening, keep up on tab to know what you are doing. And then once the medical mission is over and the family member wants to come out of the group, which is okay, we're not forcing anybody to stay there. So then they don't have to get all those constant email and messages from the Qhsc. But that's up to you. But if they want to continue staying there to see what we're doing, we welcome everybody to stay there. So they said Monday through Thursday. So Friday, that's the time that Friday, Saturday, and Sunday, that's what is the, we call, like, mental break, and then we have to take care of ourselves. So that's the time we try to go and around the country to try and see if we can have some, see what Tanzania can offer. So this year we're going to go to the national park. We call national park, all those, here you say the zoo, but these are the live animal in its own environment. So we're trying to finalize that part. Also, the confirmation is going to come as long as I know how many people. So when 0 to 10 is this much, 10 to 20 is this much. So we're gonna confirm that, but we know for sure we're gonna go to that area. So you'll be able to do that. We travel to the specific area, stay there for 2 days, and then come back. The following Monday to Thursday, again, we go for the healthcare people, we go to the second hospital and do that. For the school people, we're gonna continue doing the school because we have so many programs over there. So we're gonna give them the schedule to you. You will know, okay, Monday of the first week, I'm gonna do this, Tuesday, I'm gonna do this, Thursday, the following week, I'm gonna do something like that. So it's all organized to the last, like we need to know. If somebody asks me tomorrow what time I'm going to be doing what, I can tell you, you're going to be at the hospital doing CPR training until the end of the day. We try to keep the day from 6 to 5, but if people in healthcare, we all know, you might be like 4 o'clock, there's, I don't know, a situation in the ICU and they need help. Usually we stay there for support consultation to see, or people in ICU know how to run the code. They can say, okay, usually doing the code, you should do this and this and this, and this is the assessment, you can help. And the delivery, you can be able to help or support people who are, okay, baby's born, how do you resuscitate the baby? All those things we can help working with them to show them, okay, this is how you resuscitate the baby. This is how you resuscitate the mom. Did you start an IV? Did you do this? All those things are happening. So time can be a little fluid. Don't have to say, oh, it's 5 o'clock, I need to leave. No. Maybe some days the sensor is not that high at 3 or 4 o'clock, we are able to leave. We can leave early, which is fine. So just be open to those times. It's not like we are paying or clocking in, clocking out. So just be aware of those things could happen. Sometimes it might be, instead of 5, it might be 6. Sometimes it might be 4 o'clock, we come back home. For the school, it might be consistent because the school is over at 2. But sometimes if we have like a collaboration video with the school in Webster in Texas, those are the days that they'll be in the morning here. For us, it's going to be in the evening. So 7:30 in the morning here is going to be 4 o'clock. So that's the day for the people in school. They're going to stay longer because we have to stay late in school to be able to communicate with them here at 7 in the morning with the children. So that's how the schedule might be a little varying, but majority of the time you will know way ahead of time that is how long it's going to be. So we have an idea. And then we try to come back after Thursday, the second week. Friday usually is like an off day. So people who wants to do shopping, we have the global volunteer from Tanzania help you to go around and places that we already identify for you guys to go shopping. Once we know what your interest is, then we're going to take you people. We could make sure you are safe and then come back. And then Friday, we always have a little gathering for everybody else. And in the evening, somewhere nice to eat and party just a little bit. And then Saturday, we're getting ready to come back to US. So that's just an idea of schedule. And then so you know how much is, as I said, the meeting on August is going to give you exactly, we're going to say pack how many scrubs. These are the days, maybe the 2 days go out. So you have maybe a dress or, an outfit or suit. I mean, not a suit, that's too much dress up. I mean, the weather is warm, but still just wear decent stuff so we can go out and enjoy the country at that moment. I think that's what I have for today. Anything on the comments? Because I see there's a messages in there. Anything comments wise? Miss Christine Behuniak, I think she just typed the message. She said her advice to everybody, if you're thinking of going, do it. You will not regret it. So she's been with us for all those medical missions. She's been with all the group medical mission, all 4 of them. So, and this is the 5th medical mission. So we know that she does like going to volunteer, and the children in school love Mwalimu Christine because Mwalimu means a teacher. So they enjoy her and they want to see her. So if we are able to do it, please come and join us and we'll be happy to have you. And I'm happy to answer questions anytime. Don't feel guilty. I don't want you to say, oh, maybe I don't want to ask too many questions. No, I want you to ask as many questions as you can, because I want to make sure when you make that decision, you are informed and you know what the expectation is. I mean, there's some challenges here and there, but I want to make sure you make that decision, you know what could happen, and then at least you make a great idea. So my promise to you is the experience is going to be the one that you will never forget, personally and professionally and as a human being. You just go and make that person's life better, whether it's the child in school or the patient in the hospital, because otherwise they would never have gotten that chance in all your moments that go and help them. So thank you very much for people who show their interest. I'm hoping to hear those yes, because I'm gonna get my ticket today in 1 hour because I have an appointment with the agency to get my ticket. So anybody who is ready to join us, please come and join us. And let's go and make a world a better place.
And I would just say karibuni to everyone. You're all welcome.
Yes.